Hey there, my friends. Dr. Anna Schneider here, your back pain warrior with over 15 years of experience helping people just like you reclaim their lives from that nagging, stubborn ache. Let me ask you something right off the bat. Did you know there's a simple, natural way to melt away your back pain that doesn't involve popping pills or lying on a surgeon's table? What if I told you that something as enjoyable as a massage could be your secret weapon? Stick with me, because today, I'm spilling the beans on how massage therapy can transform your back and your life. You ready to feel proud of your body again? Let's dive in. Picture this, it's a crisp March morning in 2025, yes, we're here, March 23rd, to be exact, and I'm sitting in my office, sipping my coffee, when I get a call from a patient I'll call Sarah. Sarah's a 38-year-old mom, a teacher, and for the past 2 years, she's been battling lower back pain that's turned her into a shadow of herself. She used to chase her kids around the yard, grade papers with a smile, but now? She's hunched over, wincing with every step, feeling like her body's betrayed her. Sound familiar? Maybe you're nodding right now, thinking, Dr. Anna, that's me. Well, Sarah's story is why we're here today. Because after just a few weeks of adding massage therapy to her routine, she's back to lifting her toddler and her spirits. So, what's the magic behind this? Let's break it down together. The science made simple: why back pain happens. First, let's get real about why your back hurts. As a doctor, I've seen it all, from tight muscles to slipped discs, and here's the truth. About 80% of adults will deal with back pain at some point in their lives. That's according to the National Institutes of Health, and trust me, those numbers haven't budged in my 15 years of practice. Why? Because our modern lives, sitting at desks, staring at screens, slumping on couches, wreak havoc on our spines. Your muscles get tight, your posture collapses, and before you know it, inflammation sets in like an unwelcome guest. But here's the kicker, your back isn't broken. It's just screaming for help. Those tight muscles? They're clamping down on nerves. That stiffness? It's your body begging for movement and relief. And this is where massage therapy swoops in like a superhero. It's not just a luxury spa treat, it's science-backed medicine for your muscles. Curious yet? Let's unpack how it works. How massage therapy saves the day. So, how does a good rubdown fix your back? Let me paint the picture. When a skilled massage therapist gets their hands on you, they're doing 3 incredible things. 1. Breaking up muscle tension. Imagine your muscles like a knotted ball of yarn. Massage untangles those knots, releasing the pressure on your nerves. Studies, like one from the Journal of Pain in 2017, show massage can reduce muscle stiffness by up to 30% in just one session. That's real relief, folks. 2. Boosting blood flow. Think of your blood as a delivery service, bringing oxygen and nutrients to your aching muscles. Massage cranks up circulation. Research from the Archives of Physical Medicine and Rehabilitation found it increases blood flow by 25%. More flow, less pain. Simple as that. 3. Kicking stress to the curb. Here's a fun fact: stress makes back pain worse. When you're tense, your muscles tighten even more. Massage flips the switch on your nervous system, dropping cortisol levels, that's your stress hormone, by up to 31%, according to a 2010 study from Cedars-Sinai Medical Center. Less stress, happier back. Now, I know what you're thinking, Dr. Anna, this sounds too good to be true. But I've seen it work wonders. Take Sarah. After her first deep tissue massage, she texted me saying, "I haven't felt this loose in years." You deserve that feeling too. So, what do you think? Could a massage be your game changer? Let's talk numbers, because I'm a doctor who loves proof. A 2011 study in the Annals of Internal Medicine followed 400 adults with chronic back pain. Half got weekly massages for 10 weeks. The result? 39% reported significant pain reduction, compared to just 14% in the usual care group. That's not a fluke, that's science. And in my own practice, I've seen patients cut their painkiller use in half after regular massages. Half. Imagine reclaiming your life without leaning on meds. Then there's Mike, a 45-year-old construction worker I treated last year. His lumbar pain was so bad he couldn't bend over to tie his boots. After 6 sessions of Swedish massage combined with some stretches I gave him, he was back on the job and bragging about it. These aren't miracles, they're victories. Your victory could be next. What's holding you back from trying this? Drop it in the comments, I want to hear your story. Now, not all massages are created equal, so let's find what works for you. Here are my top picks for back pain. Swedish massage, this is your gentle, flowing option. Perfect if you're new to massage or your pain's mild. It's all about relaxation and light muscle work. Deep tissue massage, my go-to for chronic pain. It digs into those deep knots, a little intense, but oh so worth it. Sarah swears by it. Trigger point therapy, got a specific spot that's killing you? This targets those hot spots to stop pain in its tracks. Sports massage, if your back pain comes from overdoing it at the gym, this one's for you. It's dynamic and gets you moving again. Pro tip, start with a 30-minute session and chat with your therapist about your pain. They're not mind readers, tell them where it hurts. Which type sounds like your vibe? Let me know below. Here's where I get fired up, because this is about you. For too long, back pain has been the boss of your life, dictating what you can't do, stealing your joy. But you're stronger than that. Massage therapy isn't just about feeling good, it's about taking control. Every session is a declaration, I'm not letting pain win. You're not a victim, you're a fighter. I've seen patients go from barely walking to dancing at their kid's wedding. That's the power you hold. So, stand tall, even if it hurts right now, and say it with me, I'm worth this. You are. You've got the tools, the science, and a doctor cheering you on. What's one thing you'd do if your back didn't hold you back? Share it in the comments, let's dream big together. Alright, let's get practical. Ready to try massage therapy? Here's how to start. 1. Find a pro, look for a licensed massage therapist with experience in back pain. Check reviews or ask your doctor for a referral. 2. Set a schedule, one session helps, but consistency is key. Aim for once a week for 4 to 6 weeks, then adjust as needed. 3. Pair it up, combine massage with gentle stretches or heat therapy at home. I'll drop a link to my favorite stretches in the description. 4. Listen to your body, if it's too sore after, tell your therapist to go lighter next time. This is your journey. Oh, and don't break the bank, many insurance plans cover massage for chronic pain, so check yours. You've got this. What's your next step? Tell me. Well, my friends, we've covered a lot today, from the science of massage to real stories of triumph. I hope you're feeling inspired to take charge of your back pain and proud of the body that's carried you this far. I'm Dr. Anna Schneider, and I'm here rooting for you every step of the way. Now, I need your help, hit that like button if this spoke to you, and subscribe for more tips to keep your back, and your spirit, strong. Drop a comment below, what's your biggest back pain struggle? Or where are you watching from, are you in New York, London, Hanoi, or somewhere else? I'd love to know. Let's build this community of back pain warriors together. Until next time, keep fighting, you're tougher than you think.